Patients are waiting in a long queue for prescriptions at this hospital's dermatology department. They could file their prescriptions online, but many patients don't realize this is an option.
I'm not familiar with the service.
I'm too old to figure out the online stuff.
The hospital said skin diseases are ideal for online checks, as many patients simply require follow-up consultations and prescription refills. However, some patients said online consultations require medical records within the last 3 months at one hospital. Sometimes patients find their last visit was more than 3 months ago, or they didn't go to the same hospital, so they said it's easier to go in person. A hospital employee also said the hospital also doesn't promote the online option.
There are not many people asking for online services, so we don't have employees really working in this area full-time.
Also, online consultation fees are the same as in-person registration costs. However, online consultations can take longer, and the doctors don't make progress towards promotions.
Not many doctors want to see patients online. If they work, for example, in the internal medicine department or another specialty, they will eventually be promoted and earn better titles. But they will only be considered a general practitioner if they do online consultations.
Shanghai Shuhui Hospital's online department now sees 200 patients daily. 5 of its retired specialists have returned to diagnose and treat patients based on online consultations.
The COVID-19 pandemic has led to Chinese hospitals rolling out a number of internet-based services, from knowledge sharing on virus control and psychological counseling to follow-up treatment on chronic diseases. But what are the bottlenecks of these rapidly developing internet hospitals? Political advisor Li Xianhua, director of the outpatient department of Shanghai Ruijin Hospital, says medication supply and distribution are the biggest issues.
我这次呢有一个提案是互联网的这个医院的运作当中的一个。
I suggest that government and healthcare officials set up a cloud pharmacy, which supplies and distributes medication to all of our 33 public hospitals that have online medical treatment services. This will save costs for the hospital. We don't need extra labor to distribute the drugs, and patients will benefit from faster and more reliable medication delivery services.
Another political advisor suggests that internet hospitals improve the application of digital technologies, such as 5G, AI, and big data. Currently, many patients use online clinics for basic checkups via webcam, pictures, and phone calls, causing some patients question the accuracy of remote consultation.
Building a shared database is important in order to collect and analyze patients' medical data by medical technology companies, making it an integral part of patients' care plans instead of having it sit on computers unused. Community clinics and even home doctors will also have access to this information, making it easier to do a re-examination a few months later.
Patients are now able to access high-qualified and more personalized healthcare from more convenient locations. Monthly consultations on JD Health run by online retailer JD.com have grown to 2 million, a 10-fold increase since the outbreak. Registered users on Dingxiang Doctor, a medical services app, have also more than doubled. However, one political advisor has expressed concerns that the widely use of internet hospitals could lead to privacy issues.
病人个人医疗健康这些信息的这个安全问题。
Patients have the absolute right to their privacy. However, some of the patient's medical information may be valuable for medical and scientific research. The government needs to create a legal framework so the information can be used appropriately while protecting the patient's privacy.
Another political advisor, Li Huiping from Shanghai Pulmonary Hospital, says the establishment of a tiered healthcare system that can coordinate primary healthcare and hospital care is essential.
生活上不能自理呀，或者说有些什么疾病啊。
Patients can be treated at the primary or community health center level institutions for common and minor illness, and their condition can be remotely monitored by upper-level hospitals. Patients will be referred to hospitals for more complex and severe disorders. resident doctors can be deployed into communities to educate people, especially seniors.
Political advisors believe that access to the health insurance system through online payments will certainly be a great addition to China's online healthcare initiative. 张悦，上海 Live。